The quadratus lumborum is a muscle that is important because of its pain pattern. Now, it has three different sections. It goes from the 12th rib to the iliac crest, from the iliac crest to the spine, and from the spine out to the 12th rib. So three different fiber directions means that it functions very oftentimes like three different muscles. And so what we're going to see with this is that patients that walk into our office tend to turn their torso as a whole, or if they have a military background, they'll oftentimes do their facing movements in order to not twist around. Now, the normal motions we accept with this, we think of it as a hip hiker, we think in terms of lateral flexion, maybe extension when it's working bilaterally. Those are classic things. When Dr. Sellis studied this, he found it was most active in rotation, a very important area for us to think about. The pain pattern itself can go oftentimes over the greater trochanter or into the region of the buttock area. People that have that kind of a complaint, especially with the trochanter pain, often get diagnosed with a trochanteric bursitis, and they have a problem sleeping on that particular side. Generally, if that's the report and we spray and stretch the quadratus lumborum, we see that complaint go away. It's a very important thing. Other issues that might come up here is breathing dysfunction. Because of the shortening and tightening of the attachment on the 12th rib, we find a person kind of pulled over the side and compromising their breathing capacity. So it's a very important thing to work the quadratus lumborum. Other diagnoses that you might find with this are a radiculopathy type of pain. It's pretty much always involved whenever I've seen that. SI joint dysfunction just really requires treatment of your quadratus lumborum. And again, the trochanteric bursitis. So let's go on now and treat our quadratus lumborum. The quadratus lumborum muscle is an incredibly important muscle. I call it one of the bread and butter muscles. It's one of those muscles that you see every day, and if this was all you treated, you'd have plenty of bread and butter. In this case, it's incredibly important because of its referred pain pattern. We get a referral pattern down to the trochanter, often resulting in a diagnosis of a trochanteric bursitis. Patients can't sleep oftentimes on that side because of the pain referral pattern. Real important. The other area that sends pain is back into the buttock, oftentimes encouraging the formation of trigger points in the gluteal muscles and creating their referred pain patterns. So we want to make sure that we take care of that. In addition, this is a very important muscle in the fact that it tends to tip a person over to one side. So what we're going to want to do is release this. And let's go ahead and try the range of motion test as we come back. Again, that is about as far as we're going to get with that particular range of motion. So what we're going to do is bring this arm up over the top of the head. We're going to straighten this leg out. Now, bringing the arm over the top of the head pulls the rib cage up. Bringing this leg down pulls the rib cage down. One extra thing that might sometimes work, I do it every once in a while, is to roll up a towel roll and put it underneath here to create more of an arch. And that'll put more of a stretch on the quadratus. Now what we're going to do is spray over the 12th rib, over the trochanter to deal with this muscle's pain pattern. And what I'm going to be doing is I'm going to be putting pressure up on the rib cage, pressing up to create the stretch while I spray down. So deep breath in, please. And exhale. In right over the top of that trochanter. Deep breath in again. And exhale. And deep breath in again. And over the trochanter. Here we go. Okay, and now it's time to retest our range of motion. So we're going to put the hand here and relax and come back. And again, that's about twice as much motion as we had before. That would be a good range to have. We want to go ahead now and respray the other patterns and see if we can make up the rest of that range of motion. So what we're going to do is bring this thigh in the front. And what we're going to try and emphasize now is the fibers that go from the spine to the iliac crest. Again, we'll put the arm back overhead again. And this time I'll be able to angle this direction and I'll be spraying from the iliac crest, excuse me, from the 12th rib area down into the buttock. So deep breath in and exhale. And deep breath in again and exhale. And one more deep breath in and exhale. Great. And we'll check our range of motion again. And bend both knees the same. Bring the arm down. We don't want any smoke and mirrors here. And bring the shoulder back. You're not going to get a whole lot better range of motion than that, but we still have one more fiber direction to go for. We'll come back up, and before we do that, let's heat the area up, because this time I'm going to be spraying both the muscle and back into the buttock again, so we want to make sure that both areas are reheated so that she doesn't get irritated by any cold that she might get exposed to. Here, and having warmed that up, we're going to go back into our final position. The final position, we're going to lengthen the top leg, bring the lower leg behind, and rest the top leg on the bottom leg. We're going to take the arm over the top of the head, and we'll be spraying from the 12th rib back down into the buttock area. So again, go ahead, deep breath in and exhale. And deep breath in again. And exhale. And deep breath in again. And exhale. There we go. And we'll come back out of that position. And bring the arm back. And let's see what our range of motion is doing here. And again, that's essentially full range of motion. Now we want to go ahead and warm that up again. One word about not having the full range at this point. As we do this particular test, this test can be restricted by the external oblique, by the serratus anterior, and also the pec major. I'm feeling a restriction in her pec major right now. That's part of why we don't have the full range of motion at this area. So if we wanted to take care of that, that wouldn't be a difficult thing to do. Let's have a deep breath in through the nose and exhale. And deep breath in again and exhale. And deep breath in again and exhale. And again, we'll retest that motion just to see if that made a little bit of a difference, because I was feeling a restriction. And now we have full range of motion. So very important aspect to keeping this all taken care of. I have a whole lot more to heat now. But it's important to realize that there are those other things that can restrict that particular range of motion test. And by putting the heating pad this way, I'm actually getting everything. I'm able to warm up her pec, her arm, and her quadratus lumborum all at the same time. Okay. Now, a follow-up stretch for this. Let's go ahead and sit and face forward. Okay. And this particular stretch I like to give to people as a sitting stretch because they can do it at work. What I'm going to have her do is turn and look to the side and over the shoulder, look back, and come back. I like to call this the popcorn stretch. We're sitting in the theater and she's back here looking for the popcorn. And no popcorn there, and she comes back. That's the stretch. I would have that repeated 3 repetitions every hour.